Breast cancer runs in Helen's family.
This is a picture here of my dad, and that's me when I was a baby. We think that the gene was passed down through the paternal side.
But she was refused a genetic test on the NHS to check her chances of developing the disease. She had to go private and pay £1,500 to learn that she does carry a mutated gene that puts her at extremely high risk. Helen has just had a double mastectomy to cut her risk of getting cancer.
You know, to think that I could have been sat in a very naive position, not having this information. I could have slipped through the net. You know, that's actually quite shocking. I think that was probably where I was coming from. How many other women could slip through the net? You know, that could almost take what they were saying and go, all right then, I'll just go and get on with my life.
Helen's DNA contains a faulty copy of the BRCA gene, which can give a woman a risk of breast cancer 5 times greater than average and a 30 times greater risk of ovarian cancer. The NHS uses a woman's family history of breast or ovarian cancer to calculate if their risk is high enough to justify tests for the BRCA gene mutation. In 2013, the advisory body NICE recommended halving that risk threshold so women with a weaker family history of cancer would also qualify. But 2 years on, NHS England has still failed to adopt that policy. As a result, it's estimated 6,500 women who would have been tested have missed out in those 2 years. This doctor led the team which drew up the guideline for NICE.
I'm concerned that it's sort of been left on the back burner, kicked into the long grass. I mean, even in that 2-year period, there will be women who will be have been diagnosed with ovarian cancer that could have had that diagnosis prevented.
In fact, when Angelina Jolie revealed she'd had preventative mastectomies, awareness rose sharply and many more women came forward for testing, yet even that did not prompt action. NHS England says we already fund some BRCA testing and we have just completed consultation on a new policy to make access more equitable nationally and potentially also widen access in line with updated NICE recommendations. Those working to help women at risk say it makes no sense to delay any longer.
For this, where there's a cost saving as well as a life-saving benefit, I think it really needs to be looked at carefully. There aren't that many things which both save lives and save money, and that double whammy is something that should be invested in.
For Helen, knowing her risk means everything to her and her family.
I mean, I've had to be less available for my children post-surgery, and that's been really difficult. But then I've been able to tell myself that the reason that I've done that is so that I can be around for them long term. That's what every woman wants for their children, to be able to be there for them.
But currently, that's a choice being denied to many other women.